Good morning, very good morning to all. Today I'll say about force and equilibrium. Okay, what is that? Is a design thinking approach for this class. Okay, first we'll say about empathize part. Okay, empathize means problem. Okay, understand the patient balance and postural issues. Okay, now observe the how force imbalance leads to instability. Okay, then define a problem is the patient lacks stability due to the imbalance in the internal or external forces. Then goals identify the equilibrium concept for therapy. Okay. Then ideate the brainstorm how to apply biomechanical principles that discuss the force, torque, and equilibrium for partial corrections. Then prototype develop the RIGA protocol. It's a traction setup, weight balance exercise, and stability drills. Okay. Then test apply method with patient adjustment according to result. Then first we'll see about definition of force. Force equal to push or pull. Force equal to push or pull the object. Okay. Force equal to m into a. M equal to mass of the mass. A equal to acceleration. The unit is the Newton. Okay. The force changes rest or motion. The force changes rest or motion state. Okay. That is a force. Then characteristics of the force, that is magnitude, direction, and the point of application and line of action. Okay. Then types of force, the two type of force, internal force and external force. The internal force is the muscle and ligament. Then the external force is the gravity, weight, and friction. Okay. Then compression and distraction. What's the compression? The compression is the push. The distraction is a pull apart. The compression is a push the object. Now distraction is the pull the object. Okay. Then example, the spinal load is a cervical traction. The spinal load, this is the cervical traction. Okay. The spinal load is the spinal cord is the in case of degenerative condition, the spinal cord is a compression. The vertebra fully compressed. You will go for any traction procedure. You will go for aligned to the distracted to the vertebra. So this is for avoid for the relief of the compressive method. Okay. Then force system. Force is a linear, concurrent, and parallel. The resultant motion or balance depends on system type. And torque or movement. Torque is a force into distance. Torque equal to force into distance. The rotational effect of the force. The rotational effect of force equal to key for axis setup. Then equilibrium. The equilibrium, the sigma F equal to 0. The sigma T equal to 0. The static and dynamic equilibrium. The static and dynamic equilibrium in the body balance. The static and dynamic equilibrium is the body balance. Then types of equilibrium: stable, unstable, neutral. Stable, unstable, or neutral. Okay. Stable is like a example for book. Okay. Book is the stable. In the table, in the top of the table, place on the book. That is a stable. Okay. Then unstable. That is the ball. Ball is the unstable. It's a moving the top of the table. Ball is the not rest. You're moving on the other side. Moving on the both sides of the moving. That is the unstable. Neutral. Pen. Pen is the top of the table. This is the one is that keep on the rest period on the shell. You will keep move on the writing process. You will move to the moving to the pen. That's the both neutral aspect. Now, another example of the neutral is the body is a Tanjore toys. Is a toys movement of the there's a neutral process. The clinical relevance is the understanding the force helps the design safe, effective, and the program. Then empathy review focus on the how force imbalance affect the patient with postural deficit. Then ideate review, that is a develop strategy, balance training for muscle strengthening and ergonomic alignment. Okay, these are the changes of the ideate process of the biomechanical process. What is strategy means how to improve the biomechanical correction of this system. Okay, how to improve the balance system. That is the implement the balance training. Okay, so what is the balance training implement to improve the balance system? Then you will balance training improve the muscle strengthening. The muscles strengthen, they will improve the balance training. Both of the muscle improve, the balance improve, then ergonomic alignment also changes in the which direction. Then class assessment. Students write notes a proper question. Tomorrow you will submit the. Everyone should be keep the A4 sheet in the answer sheet. Okay. Then define force and equilibrium. Okay. Define force and equilibrium. Second question. Differentiate internal versus external forces. Third question, case scenario. Patient cannot maintain standing. Patient cannot maintain standing. Identify the acting forces. Then fourth question, suggest the equilibrium improved method. Okay, these are tomorrow we'll submit on the tomorrow morning we'll submit in this questions answer sheet. Okay, thank you.